Morning, this is Dr. G from Trusted Dental Care in Wiley, Texas, the Dallas area. Today I'm going to talk to you about, this is in a continuation of what we talked about last time. I did a test in regards to saliva test. Basically what the saliva test is that to determine your bacterial load, if you have any of those harmful bacteria in your mouth. And so I do have the results, you guys. It's fascinating. I'm super excited about this because it's really science, okay? So I love to practice dentistry with an evidence base. And obviously, like I said, this is the next level treatment recommendation because you do actually have the tools to treat, okay? So just a little statistics, so far what we know is that anywhere 60 to 70% of the population in the US has gum disease, period disease, and so this test is going to help tackle that gum disease, okay? Obviously, like I showed you last time, I took a little sample, my hygienist took a little sample, and then we sent it to the company, and their biotech company, and they would do a saliva test. What they will know is that if I have the bad bacteria. Obviously, we all have bacteria, but the bacterial load or the threshold should be below the harmful. Basically, it's called the threshold, right? So if the bacterial load is below the threshold, that means that it's not going to do any harm. But if it's above, that's when it actually makes a lot of harm. So I'll show you my results. There's like graphs and explanations of it. If I do have it, if it's above, then they will give me a treatment recommendation, all that, okay? So you excited about this? Here it is. As you can see, if you zoom in, this shows my name right here, okay? The test was taken on November 3rd, 11/3/2022. So I just want to be very, very candid. This is my result. I laminated it just so that I actually can share this with my patients, okay? So what this shows me, you can see there's a bar graph going on. These are the high-risk pathogens, as you can see. These lines are the threshold, okay? Can you zoom in? Can you see? Mm-hmm. Yeah, so this lines right here is the threshold. And what this shows me is that I'm way below threshold in every category right here, okay? So there's this one here, a little bit somewhere in the middle, but still way below threshold. So I'm pretty good on the high-risk pathogens. I don't have any high-risk pathogens that I'm concerned about, okay? Now I'll go to the moderate-risk pathogens. You can see there's lines right here, and that line shows me the threshold, okay? Anything below that threshold, I'm not concerned about it, but anything above that threshold, I should seek treatment immediately, okay? So you can see that this is a line, I don't have anything here. This is a line, I'm below the threshold, I don't have anything below the threshold. And this right here is the low risk pathogens. Again, you can see the line, and then you can see where I am. So my result actually came out everything below threshold, okay? And that's kind of what I was hoping for. Obviously, I'm a dentist, I'm my own hygienist, I do all the hygiene, everything that I tell you, I practice every day. Can you imagine how embarrassing it would have been if I have above threshold and I'm telling people to get treatment? That would have been very embarrassing, but luckily, I actually follow it. I do whatever is recommended, and it's working pretty good, okay? So, and then the next thing here, as you can see, would be interpretation of the results, okay? So it shows, again, like I previously said, this letter is signed by a medical doctor. You can see medical director, Dr. Ronald McLennan, MD. So they run the test, and then I get a sign by MD what this results means, because there is an oral systemic connection, and they'll actually interpret the data. What does that mean, and what I'm at risk of, and all that. So interpretation results, it says that this result shows a combination of 1 high risk and 3 moderate risk pathogens and low risk, each below the therapeutic threshold. Okay, that's the key. The key is each one of them, even though you can see I do have 1, but it's still below the therapeutic threshold. Okay, the bacterial species are strongly associated with chronic perio and transmissible and tissue invasive even at low amounts of these organisms. What that just tells me is that I gotta keep up with my hygiene all the time. You know what that means is, like, if you look at this one here, I do have 1 high risk pathogens present, although it's below threshold. But if for whatever reason I let go of my hygiene, I'm not following the protocol, I'm not getting my cleaning every 3 months, guess what's gonna happen? That pathogen would creep up, goes above threshold. That's the reason why we recommend the patients to, once you have, scaling, root planing, treatment done, you have to maintain it. Otherwise, that bacteria creeps up, makes more damage. Okay, this makes a lot of sense, you guys. So anybody who's watching this, if you find, if you're not quite understanding what this really means, if you're in the Dallas area, I can come out of my office, I can show you what this really means, you can read it for yourself. The other component I wanted to add to this is that this test is expensive test, and the reason being is that one, no insurance pays for this kind of stuff. Obviously, as you know, insurance don't really care, okay? But you're responsible for your own health. No insurance is gonna come and save you. And so ultimately, you have to believe in that. You have to seek value in this test. And 2, the reason it's expensive is, let's say if I have above threshold, okay? So what I would have to do would be get a treatment, and the other, I'll show you what this also means. That the other, what that means is that I would get the initial baseline measurements, and then I would do the treatment. In other words, if I need scaling root planing or laser treatment or antibiotics, whatever, we would do all that, and then we retest again to make sure if the treatment we have done actually got rid of the bad bacteria. That's the reason. So this is not a one-time test, but it's actually twice. Luckily in mine, I don't need to retest again. The reason is I'm below the threshold already. All I have to keep doing would be just do my maintenance. But let's say if I have a patient that has above threshold, then what we would do would be, get them the treatment, and then 6 weeks later we would test them to make sure that if whatever we have done resulted in below threshold results. And so that's that. As you can see, the other, part of the result also is like antibiotic options. And so each patient, based on their results, based on what kind of bacteria they have in their mouth and their load, then I would give a recommended, obviously you can see a bunch of choices here. So not every antibiotic is going to be for the same person. In other words, patient A might get this antibiotics, patient B might get this antibiotic based on their results. So it's a customized results. And frankly, this is probably the best thing that excites me as we move forward, because like I said, in our patient population, we do see severe perio that's quite frankly way more than, like I said, even though the average in the US adult population anywhere has 60 to 70% some type of perio. In my patient population, I do see a lot of immigrants, we see that number a lot higher. And so this should be a game changer as we move forward. I'll end this video right here, but if you have any questions in regards to what this is all about, I'm here for you. You can email me, you can send me a message, and then we'll go from there. Adios.
Adios.